For decades, public health efforts across sub-Saharan Africa have focused on HIV prevention, testing and treatment campaigns on children and women of reproductive age, overlooking those of a more advanced age. One consequence of this is that the HIV pandemic is increasingly affecting older people. For more, we are now joined by Xavier Gomez-Olive, who is a research manager at the Agincourt Research Unit at Wits University. Xavier, thank you so much for joining us this evening. Why are we seeing this uptick amongst the older groups, and what age group in particular?
Good evening, and thanks for having me. The process of aging, what we call the aging of the HIV epidemic, it's mainly due to two things. One thing is the aging of the population in general. In the world and in Africa, its population is aging, and we are having to all the ages. And since the introduction of the antiretroviral treatment, the mortality or the lethality due to HIV has reduced drastically, which means that the population that had HIV and they were dying at young ages, that is a part of the history now, and this population are aging and getting to all the ages. Our study was from 40 to 60 years old, but we know that population over 50 are also growing or getting into all the ages with the HIV that they had contracted at younger ages. And what we have now seen is that all the people are also getting infected at these older age groups.
So that would be some groups where they already had contracted it when they're younger and they're just growing older with the disease?
We have both. And the idea initially was that it was a survival situation that we were seeing. All the people were getting older with HIV, and that was the belief at the beginning. What we have proven with this study is that population at all the ages, they are also contracting HIV, they are getting new infections, and they are exposed to having these new infections. And this is mainly because, as you said at the beginning, the campaigns and the programs have been focusing on younger population, have been focusing in normally under 50 years of age, and then this population or the population are not aware that they can also get or can contract the HIV infection and that they are at risk. And then they are not taking the measures that they should take to protect themselves. They get into new relations without knowing the HIV status of their new partners, and they are putting all this population at risk also for HIV infection.
And just briefly, before I let you go, you've touched on this now, but what are some of the myths that you found conducting the study that need to be debunked?
The main thing is that HIV is not an epidemic for younger people. It is true that historically it started with younger people, and that we all know that the older population, especially in Africa, were the ones looking after the orphans of the HIV epidemic. But with the survival of the people on ARTs and with the new infections that we are having now, these older age groups, we have to think this is also an epidemic of older population, people over 40 and 50, they are contracting HIV, and we have to focus on them. We have to organize primary healthcare systems on integrated care for all the population, not only for hypertension and diabetes, but also thinking that they can be infected with HIV.
Thank you so much for your time. Really appreciate it. That was Xavier Gomez-Olive just talking to us about that study showing an increase in people contracting and living with HIV over the ages of 40 and 50.